Hi, Patho students. Welcome to part 2 of chapter 9. We're going to talk about systemic manifestations of inflammation, chronic inflammation, and fever. Sometimes the chemical signals of inflammation are released into the circulation. This triggers a systemic inflammation, and in fact, tumor necrosis factor and interleukin-1 will affect the thermoregulatory center of the brain, or the hypothalamus, and produce fever. Within hours or days of the inflammation, a number of cytokines are released. The key ones to remember again are tumor necrosis factor and interleukin-1. These cytokines produce fever acting on the hypothalamus, and they also produce symptoms of anorexia, somnolence, and malaise. They stimulate the liver to produce more inflammatory proteins. One of these would be CRP. CRP is C-reactive protein, and it's actually a marker that we can measure in a lab study to determine if there is systemic inflammation. Additionally, we will produce higher fibrinogen levels, and these can cause our red blood cells to accumulate or stick together, and they actually will settle in the bottom of a test tube. And this particular lab test, again a marker for systemic inflammation, is called a SED rate, or a sedimentation rate. So SED rates that are elevated tells us that there is some type of systemic inflammation. It's not very specific though. So actually not terribly helpful. Neither one. These measures are, again, they tell you have inflammation, but you have no idea where. When signals are released in the circulation, we will also experience some heightened production of white blood cells. And all of this will become more clear when we discuss blood cells, but leukocytosis is common in systemic inflammation. We expect to see more neutrophils produced, and in that situation, we will have more immature cells than we would normally have because we have more production. And so if we have more cells on the left side of the line and more immature cells being formed, then we call this a left shift. Bacterial infections are notorious for, and we would expect, increased production of neutrophils and the left shift. If we have a parasitic infection or an allergic response, then it would be common to see the eosinophils increase in number, so eosinophilia. In severe bacterial infections, or sepsis, the large quantities of microorganisms in the blood result in an uncontrolled inflammatory response. And that results in general vasodilation, increased vascular permeability, loss of intravascular fluid, and myocardial depression. And we'll talk about septic shock in a later chapter, but I want you to notice if we vasodilate, we increase permeability, which loses intravascular fluid. All of these things are setting us up for a major drop in blood pressure. And that's a big symptom of septic shock. Chronic inflammation is characterized by an immune or inflammatory response that lasts 2 weeks or longer. The response is frequently local. For example, in the lung, when we have low-grade persistent infections or irritants. Also, could be, this is a granuloma on this person's finger. So there's been inflammation that's gone on here longer than 2 weeks or more. It happens when the acute inflammatory response wasn't successful in getting rid of the bacteria or the irritant. Also, there could be some low-grade persistent infections or irritants. One of the things that's known to cause irritation in our lungs would be talc. So we used to see a lot of talc being used on our skin, and now we don't see talc anymore because of the chronic irritation, and actually has been known to be a carcinogen. Interestingly enough, obese people probably have more chronic inflammation because adipocytes have been shown to release tumor necrosis factor A. In chronic inflammation, we expect to have less localized edema and less neutrophil infiltration, but instead, the macrophages and lymphocytes accumulate in the damaged area and keep releasing those inflammatory mediators. It can be asymptomatic at first, but over time, the inflammatory cells will cause tissue damage. Granulomas can happen anywhere in the body. This happens to be a granuloma on the finger. In my practice with chest surgeons, the most common cause of granulomas was a tuberculosis infection. So granulomas, again, are formed when macrophages are unable to fully clear an invader, so they wall off the invader, forming a mass. So what we've spoken about in acute inflammation, where we had localized swelling and neutrophil formation, in chronic inflammation, the macrophages and lymphocytes accumulate in the damaged area, and as I said, continue to release these inflammatory mediators. Chronic inflammation is thought to be a factor in cervical, liver, and stomach cancers because over time, with this constant inflammatory process, we have damage to the DNA. Also, in hardening of the arteries, the chronic inflammation has been implicated. And if you notice in this picture, a sign of chronic inflammation would be these foam cells, and these foam cells collect and lead to hardening of the arteries or atherosclerosis. Before we conclude the discussion of inflammation, let's talk a bit about fever. Why do we get fevers? Well, that's not really known for sure, but we do know that some proteins and their breakdown products cause body temperatures to rise above the set point established by the hypothalamus. So the usual set point would be 98.6 degrees Fahrenheit. Fevers are a non-specific indication of some type of disease. People with fevers generally have loss of appetite, loss of energy, and additionally, fevers are often accompanied by chills. So when we release these pyrogens from host macrophages or from endothelial cells, they trigger the release of prostaglandins. And the prostaglandins reset the hypothalamus temperature set point. At that point, our body thinks it has to reach a new temperature set point. So we attempt to warm ourselves to that higher temperature. And that happens through several things, including shivering. So when we've reached the new set point, the chills will stop. Normally, our body temperature is 37 degrees centigrade or 98.6 degrees Fahrenheit. The hypothalamus temperature can reset up to 41 degrees or 105. It is possible for people to have a higher temperature, but temperatures over 105 in adults generally signal that we have a CNS or a central nervous system problem. These types of temperatures are called neurogenic fevers, and they're generally caused by damage to the hypothalamus. That could be from head trauma, from intracerebral bleeding, or other causes of increased intracranial pressure. In pediatrics, and really in geriatrics too, remember that the degree of the fever doesn't indicate the severity of the illness. This is because children have underdeveloped mechanisms for controlling fevers. Also remember that most febrile children do have an underlying infection. Older adults, like kids, the temperature is not an accurate gauge of the infection severity. Slight elevations in temperature can indicate a serious infection. Older patients often have blunted immune responses, like alterations in pyrogens, failures of other physiologic changes that we would expect to see. For example, they might not vasoconstrict the skin vessels fully, and they may not shiver to generate additional heat. They also may have lost the ability to reset the temperature set point in the hypothalamus. So no fever or even a temperature below 98.6 does not rule out an infection in an older person. And that concludes Chapter 9, Part 2. In Part 3, we'll talk about tissue repair and wound healing.